Welcome back to Living Well After 50. Are you missing the early warning signs of COPD? Discover 24 subtle symptoms you can't afford to ignore. Hashtag 13 might surprise you.
That's right.
And before we get started, don't forget to sign up for our free newsletter
Yeah.
for even more tips on living your best life after 50.
Absolutely.
Okay, let's dive into this.
Okay.
We've got a mountain of research on COPD,
Yeah.
and we're here to help you make sense of it all.
We are.
You know, a lot of people think
Fine.
that COPD just means a smoker's cough.
Right. A smoker's cough.
But it's so much more than that.
It is so much more than
And the
that.
sooner you catch it,
Right.
the better.
Absolutely the better.
So,
Yeah.
what's the first thing folks should be aware of?
Well, shortness of breath is a big one.
Shortness of breath.
Shortness of breath.
Okay.
If you're suddenly out of breath doing things that used to be easy,
Uh-huh.
like climbing stairs or even just walking around the house,
Yeah.
that's a red flag.
Wow. I bet a lot of people might dismiss that as just getting older.
Exactly.
Right.
It's easy to write it off,
It is.
but it's worth getting checked out.
Yeah, for sure.
Yeah.
What else should we be looking for?
Wheezing,
Wheezing.
especially when you exhale.
Exhale.
It's
Yeah.
another sign. It's that high-pitched whistling sound.
Oh, like when you're trying to blow out those pesky birthday candles.
Yes, something like that.
Okay.
And chest tightness.
Chest tightness.
Almost like someone's sitting on your chest.
Okay, that doesn't sound good at all.
No.
Anything else that might surprise people?
Well, swollen ankles.
Swollen ankles?
Many people don't realize that fluid buildup in your legs can be linked to COPD.
That's really interesting.
Yeah.
So it's not just about your lungs.
Right.
It can affect other parts of your body too.
Absolutely.
Yeah, that's crazy.
And keep an eye out for changes in your appetite and weight loss.
Appetite and weight loss.
It's often overlooked,
Okay.
but COPD can make it harder to eat and absorb nutrients.
Now that's something I never would have connected to COPD.
Right. And even things like insomnia and feeling anxious or confused could be related to low oxygen levels because of COPD.
What? Oh, so many things to be aware of.
Right.
Okay, so we've got
Yeah.
shortness of breath,
Yeah.
wheezing,
Uh-huh.
chest tightness,
Yeah.
coughing,
Coughing.
swollen ankles,
Right.
changes in appetite and weight,
Uh-huh.
and even
Yeah.
sleep disturbances and mental fog.
Yeah. All related.
Anything else we should be aware of?
Yes. There's another symptom that often raises eyebrows. Cyanosis.
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 That sounds a bit ominous.
It sounds more complicated than it is.
Okay.
It simply means a bluish discoloration of the skin, lips, or nail beds.
Okay.
And it happens when there's not enough oxygen in the blood.
So if I notice my lips or fingertips looking a bit blue,
Right.
that's a sign to get help right away.
Absolutely.
Okay.
It's a signal that your body is struggling to get the oxygen it needs, especially if you're experiencing other COPD symptoms.
Okay, that's one I'll definitely be keeping an eye on.
Yeah.
What about changes in appearance?
Yeah.
Can COPD affect how we look over time?
It can.
How so?
Have you ever heard of barrel chest?
Barrel chest.
Barrel chest.
That sounds a bit alarming.
Yeah.
What is that exactly?
It's a gradual change in the shape of your chest,
Okay.
where it takes on a more rounded, bulging appearance.
Oh, wow.
Yeah. Why does that happen?
It's caused by chronic overinflation of the lungs,
Okay.
often because of trapped air.
Interesting.
Your lungs are constantly working harder to breathe,
Mm-hmm.
and over time, this can change the structure of your chest.
I'll have to check myself out in the mirror later.
Yeah.
What other physical changes might we notice?
Well, people with COPD sometimes develop a hunched or forward-leaning posture.
Really?
Yeah.
Why would that be?
They do this subconsciously to try to make breathing easier
Okay.
by leaning forward and supporting their upper body with their arms.
They can expand their chest and improve airflow.
It's amazing how our bodies try to compensate even without us realizing it.
It is.
So we've got the barrel chest,
Right.
the hunched posture. Anything else?
Yes. There's also exercise intolerance.
Exercise intolerance.
As COPD progresses,
Yeah,
you might find it harder and harder to do the activities you used to enjoy.
I can see how that would be discouraging.
It can be.
Yeah.
Even simple activities like walking or gardening might become challenging,
Yeah.
leading to a more sedentary lifestyle.
And that can lead to a whole host of other health problems, right?
Exactly. It's
Yeah.
a slippery slope.
Yeah, for sure.
Now, here are a couple of unusual symptoms that you might not expect at all.
Okay.
Some people with COPD experience itching around the chin or neck.
Itching.
Itch?
How is that connected to breathing problems?
It's not entirely clear,
Okay.
but it's thought to be related to either nerve irritation or a subtle response to respiratory distress.
Interesting.
And then there's dizziness,
Dizziness, okay.
which can be a sign of decreased oxygen levels in the blood.
I bet that would be especially noticeable when you're active or stand up quickly.
You're right.
Yeah,
Those are times when your body needs more oxygen.
right?
And if it's not getting enough, you might feel lightheaded or imbalanced.
Okay, so we've covered a lot of ground here.
We have.
Shortness of breath,
Uh-huh.
wheezing,
Right.
coughing,
Right.
swollen ankles,
Okay.
weight changes,
Yes.
sleep issues,
Right.
anxiety,
Uh-huh.
cyanosis,
Yep.
changes in chest shape and posture,
Right.
exercise intolerance,
Yes.
itching, and dizziness.
Yes.
Is there anything else we should be on the lookout for?
Yes. A few more.
Okay.
Rapid breathing,
Rapid breathing.
also known as tachypnea,
Okay.
can be a sign that your body is working overtime to compensate for inadequate gas exchange in the lungs.
I imagine that would feel pretty intense.
It can.
Like you just can't catch your breath.
Right, exactly.
Okay.
And then there are changes in your appearance during a COPD exacerbation,
A COPD exacerbation.
which is basically a sudden worsening of your symptoms.
Okay.
You might notice that your face becomes pale and sweaty
Okay.
due to reduced oxygen levels and the strain of trying to breathe.
Wow. So COPD can really affect how we look and feel in so many ways.
It can,
Yeah.
and it can even disrupt our sleep
Our sleep.
beyond the insomnia we talked about earlier.
Beyond the insomnia. Yeah.
Yeah.
What other sleep-related issues might arise?
People with COPD often have trouble sleeping
Okay.
because of nighttime coughing, shortness of breath, and anxiety about their breathing.
Right.
It's a vicious cycle because lack of sleep can then worsen COPD symptoms.
So we've got the pale, sweaty face
Uh-huh.
and trouble sleeping.
Right.
Anything else?
Yes, there's hypoxemia,
Hypoxemia.
which simply means an abnormally low level of oxygen in your blood.
Okay.
It is.
Sounds serious.
It can lead to a cascade of symptoms,
Okay.
including the shortness of breath, fatigue, confusion, and cyanosis we've already discussed.
Right.
And because your brain isn't getting enough oxygen,
Yeah.
it can affect your thinking, making it harder to concentrate, remember things, and make decisions.
This is really eye-opening.
Yeah,
It's not just about our physical health,
right.
but our mental clarity as well.
It affects everything.
Yeah.
All of this can lead to feelings of anxiety and panic,
Huh.
which can further worsen breathing difficulties.
Yes.
It's a domino effect where one symptom can trigger another.
That's a great way to put it.
And speaking of domino effects,
Yeah.
remember how we talked about people with COPD changing their posture?
Right.
Well, during an exacerbation, this can become even more pronounced.
Okay.
They might lean forward, propping themselves up with their arms to help expand their chest and get more air.
It's incredible how our bodies instinctively try to find ways to breathe easier.
It is.
Yeah.
Now, let's move on to a couple of symptoms that might seem completely unrelated to COPD,
Okay.
but can actually be red flags.
Okay. I'm all ears.
Have you ever experienced dry mouth?
Dry mouth.
Especially in the morning,
Oh, yeah. All the time.
right?
I just figured it was because I didn't drink enough water before bed.
It could be,
Yeah.
but it can also be a sign of COPD,
Really?
especially during a flare-up.
Interesting.
When you're struggling to breathe, you tend to breathe through your mouth,
Uh-huh.
which can dry it out,
Who knew?
right?
I'll have to pay more attention to that.
Yeah.
And finally,
Family.
keep track of
Yeah.
how often you're using your rescue inhaler.
Your rescue inhaler.
If you find yourself reaching for it more often than usual,
Yeah.
it could be a sign that your COPD is worsening
Right.
or that your current treatment plan isn't as effective as it should be.
Exactly.
So that's a sign to talk to your doctor about adjusting your treatment.
Exactly.
Okay.
It's important to be proactive and stay on top of your COPD management.
This has been incredibly insightful.
It has been.
We've uncovered so many subtle signs of COPD that I think many of us might have easily dismissed before.
That's exactly what we wanted to do. Help you understand this complex condition and empower you to take control of your health.
Absolutely.
Yeah. And one thing that can really help you stay on top of your lung health is a peak flow meter.
A peak flow meter.
Yeah.
That's a new one for me.
Okay.
What is that exactly?
It's a simple handheld device that measures how quickly you can exhale air from your lungs.
Oh, okay.
Yeah.
So it's like a personal breathalyzer for your lungs.
You could say that.
Okay.
Yeah. It's a way to track your lung function at home and notice any changes early on.
I like that.
Yeah.
Being proactive is key.
Right.
So if our peak flow readings start to dip,
Yeah.
that's a sign to call our doctor.
Exactly.
Okay.
It's all about catching those subtle shifts before they become bigger problems.
This has been a real eye-opener.
Yes.
We've covered so much ground already.
Yeah.
But before we move on,
Uh-huh.
I want to touch on something that I think is especially important for us over 50.
Yeah.
It's easy to dismiss some of these symptoms as just part of getting older.
Right.
How can we be sure we're not just brushing off something serious?
That's such an important point,
Yeah,
and it's a common concern.
right.
Here's the thing.
Ooh,
While some age-related changes are normal,
right.
any sudden or significant decline in your breathing shouldn't be ignored,
Okay.
especially if you have risk factors like a history of smoking or exposure to lung irritants.
So trust your instincts.
Yeah,
If something feels off, don't hesitate to get it checked out.
exactly. You know your body better than anyone.
Right.
And early detection is crucial for managing COPD effectively.
Absolutely.
Yeah.
Now let's shift gears a bit
Okay.
and talk about what we can do to help ourselves if we've been diagnosed with COPD.
Okay.
What are some lifestyle changes that can make a real difference?
Well, the first and most important step is to quit smoking if you haven't already.
I know that's easier said than done,
Right.
but it's essential, right?
It is.
Yeah.
Smoking is the #1 cause of COPD.
Right.
And continuing to smoke will only accelerate the damage to your lungs.
So quitting is a must.
Yeah, absolutely.
What about diet and exercise? Do they play a role in managing COPD?
Absolutely.
Yep.
Eating a healthy, balanced diet can help you maintain a healthy weight
Uh-huh.
and give your body the nutrients it needs to function properly.
Right.
And regular exercise,
Okay.
even if it's just gentle walking,
Yeah.
can improve your lung function and overall fitness.
So it's not about becoming a marathon runner overnight.
No.
It's about making sustainable changes that we can stick with.
Exactly. And it's important to work with your doctor to develop a personalized exercise plan that's safe and effective for you.
That makes sense.
Yeah,
Now, we've talked a lot about the physical aspects of COPD,
right.
but what about the emotional and mental health side of things?
Okay.
This sounds like a pretty tough condition to live with.
It can be.
Yeah.
COPD can significantly impact your quality of life. And it's common to experience feelings of anxiety, depression, and even fear.
I imagine it can be quite isolating, too,
Yeah,
especially if you're limited in what you can do physically.
that's true.
Right.
Social isolation is a real concern for people with COPD.
Yeah.
That's why it's so important to find ways to stay connected with friends and family.
Right.
Consider joining a support group where you can connect with others who understand what you're going through.
I think that's such a valuable point.
Yeah,
Knowing you're not alone can make a world of difference.
it really can.
Yeah.
And don't underestimate the power of talking to a therapist or counselor.
Okay.
They can help you develop coping mechanisms for dealing with the emotional and mental challenges of COPD.
It's all about taking a holistic approach to managing this condition,
Exactly.
addressing both the physical and emotional aspects.
Exactly.
And remember, there is help available.
Yeah,
Don't suffer in silence.
right.
Reach out to your doctor, your loved ones, and support organizations.
Uh-huh.
You don't have to go through this alone.
Right.
That's such a powerful message.
It is.
We've talked a lot about the importance of early detection,
Right.
but why is it so crucial to catch COPD in its early stages?
Well, for one thing, early treatment can help slow the progression of the disease and prevent further damage to your lungs.
Okay.
It can also reduce the frequency and severity of those exacerbations we talked about earlier.
So basically, it can help you maintain your quality of life for longer.
Exactly.
Okay.
And it can also reduce your risk of developing other serious health problems,
Like what?
like heart disease, lung cancer, and pneumonia.
Wow, so the benefits of early detection are far-reaching.
They really are.
Yeah.
And that's why it's so important to be proactive about your health, especially as we get older.
So true.
Yeah.
We need to be advocates for our own well-being and not be afraid to ask questions and seek help when we need it.
Absolutely.
Now let's talk a bit more about those exacerbations.
Okay.
What exactly triggers them, and what can people do to prevent them?
Okay, that's a great question.
Yeah.
We touched on them briefly.
Great.
But I'd love to hear more about what causes those flare-ups and how to avoid them.
Yeah, for sure.
Well, the most common trigger for COPD exacerbations is a respiratory infection, like a cold or the flu.
That makes sense.
Yeah.
I know when I get a cold, my breathing always feels a bit worse.
Right.
Yeah.
And for people with COPD, even a mild cold can lead to a serious flare-up.
Oh, wow.
That's why it's so important to get your annual flu shot
Okay.
and to practice good hygiene, like washing your hands frequently and avoiding contact with sick people.
So basic preventative measures can make a big difference.
They can.
Yeah.
And air pollution can also trigger exacerbation.
Oh, that's right.
Yeah.
We hear so much about air quality these days.
Yes. And for people with COPD, it's really important to pay attention to air quality forecasts
Uh-huh.
and to stay indoors on days when pollution levels are high.
Checking the weather report isn't just about avoiding rain anymore.
Right.
It's about protecting our lung health, too.
Exactly. Wow.
And, sometimes even strong odors or fumes can trigger an exacerbation.
Really?
Yeah.
Even things like perfume or cleaning products?
Yes, for some people, those types of irritants can be a problem.
Okay.
It's all about knowing your triggers and avoiding them as much as possible.
It sounds like a lot of it comes down to being aware of our surroundings
Yeah,
and taking steps to minimize our exposure to potential irritants.
that's a big part of it.
Okay.
And it's also important to manage stress.
Stress.
Correct.
How does that play into COPD?
Well, stress can weaken your immune system,
Right.
making you more susceptible to infections.
Okay.
And it can also directly worsen your COPD symptoms.
So finding healthy ways to manage stress is important for both our mental and physical health.
It really is.
Yeah.
Things like yoga, meditation, or spending time in nature
Yep.
can be incredibly beneficial.
Those are all great ideas.
Yeah.
And what about medications? I know there are different types of medications used to treat COPD.
Right.
Can you tell us a little about them? Of course.
Okay.
There are two main types of medications used to manage COPD: bronchodilators and inhaled steroids.
Okay, let's break those down.
Okay.
What do bronchodilators do?
Bronchodilators relax the muscles around your airways,
Okay.
which helps open them up and makes it easier to breathe.
So it's like giving your airways a little bit of breathing room.
Exactly. They come in both short-acting and long-acting forms.
Okay.
Short-acting bronchodilators are used as needed for quick relief from symptoms,
Right.
while long-acting bronchodilators are taken daily to help control symptoms over time.
And what about inhaled steroids?
Inhaled steroids help reduce inflammation in the airways,
Okay.
which can improve breathing and prevent exacerbations.
So they're tackling the underlying inflammation that's causing the problem.
Right.
Okay.
And they're usually prescribed for people with moderate to severe COPD.
So it sounds like there are a lot of different options available.
Yeah.
And the best approach is to work with your doctor to find the right medications and dosages for your individual needs.
That's exactly right.
Got it.
And it's important to take your medications as prescribed.
Right.
And to follow up with your doctor regularly to monitor your progress and make adjustments to your treatment plan as needed.
Okay, we've covered a lot of ground today.
We have.
From early warning signs to lifestyle changes to medications,
Yeah.
it's been a truly comprehensive deep dive into COPD.
It has.
But before we wrap up, I have one more question for you.
Okay.
What's the most important piece of advice you would give to our listeners over 50 who are concerned about COPD?
My advice would be to listen to your body
Okay.
and don't ignore any changes in your breathing.
Such simple advice, but so powerful.
It is.
Yeah.
Early detection is key.
Right.
If you notice any of the symptoms we've discussed today,
Uh-huh.
especially if you have a history of smoking or exposure to lung irritants,
Yeah.
please talk to your doctor.
We can't stress that enough.
No.
Your health is your most valuable asset, so take care of it.
Exactly.
And remember, even if you have been diagnosed with COPD, there is hope.
There is.
With proper management, you can still live a full and active life.
That's a wonderful message to end on.
We've learned so much about COPD today,
Yeah.
and I hope our listeners feel empowered to take charge of their lung health.
Me too.
It's so inspiring to hear stories of people who are thriving despite having COPD.
Right.
It really shows that this diagnosis doesn't have to define you.
Absolutely.
Yeah.
There are so many resources and support systems available to help people manage their condition and live their best lives.
Uh-huh.
It's all about finding what works for you and staying positive.
Well, this has been an incredibly informative and empowering deep dive into COPD.
It has been.
I know I've learned a lot, and I hope our listeners have too.
Me too.
It's been a pleasure sharing this information with you and our listeners.
Yeah, it really is inspiring.
It is.
Like you said earlier, knowledge is power.
Yeah.
And I think we've given our listeners a powerful toolkit today
To
to better understand COPD and take charge of their lung health.
I agree.
Yeah.
We've covered so much ground, from the subtle early warning signs
Yeah.
that often get overlooked
Yeah.
to the importance of lifestyle changes and medical management.
Yeah, absolutely.
And we've emphasized that even if you've been diagnosed with COPD,
Right.
it's not a life sentence.
Absolutely not.
You can still live a fulfilling life.
You can, with the right support and a proactive approach,
Right.
you can manage your symptoms and maintain your quality of life.
I think that's a really important takeaway for our listeners.
Yeah.
COPD doesn't have to define you.
It doesn't.
There are so many resources and support systems available
Yes, there are.
to help you thrive.
Absolutely. And I encourage everyone to reach out to those resources.
Yeah.
Connect with others who understand what you're going through. Share your experiences and learn from one another.
Community is so important, especially when facing a health challenge.
Absolutely. It really is. And remember, there are healthcare professionals dedicated to helping you manage your COPD. Don't be afraid to ask questions. Advocate for yourself and work together to create a treatment plan that meets your needs.
We've talked a lot about the physical aspects of COPD, but I want to circle back to the emotional and mental health side of things.
Absolutely.
It's so crucial to acknowledge the emotional impact of this condition.
It is.
It's normal to feel a range of emotions.
Yeah.
Anxiety, fear, even a sense of loss.
Those feelings are valid, and it's important to find healthy coping mechanisms.
Like we discussed earlier.
Yeah.
Things like yoga meditation, spending time in nature,
Right.
or connecting with loved ones can be incredibly beneficial
Absolutely.
for both our mental and physical well-being.
I couldn't agree more. And if you're struggling,
Yeah,
don't hesitate to seek professional help.
right.
A therapist or counselor can provide invaluable support and guidance.
This has been an incredibly insightful and empowering deep dive into COPD.
It has been.
I know I've learned a lot, and I'm sure our listeners have too.
I'm sure they have me too. It's been a pleasure sharing this information with you and our listeners.
And remember, folks, if you're over 50 and noticing any changes in your breathing, don't dismiss them. Talk to your doctor, get checked out, and be proactive about your lung health.
Yeah,
Early detection and intervention can make a world of difference.
absolutely.
Until next time, stay well and keep living your best life after 50.